Psychiatric facilities across the country are struggling to procure patient medications. Now, this is because the Mental Health Authority receives an average of just 30% of its annual budget from government, forcing it to introduce a pay-as-you-go model of operation. The authority believes the provision of a dedicated source of revenue will help reduce the burden on the psychiatric facilities and persons who require mental health care services. We'll hear from CEO of the Mental Health Authority shortly. First, though, excerpts of our latest Hotline documentary highlighting quality rights in mental health care. Mind Matters.
Behind the rising mental health cases in the region is a sheer insufficiency of staff within the various health facilities to attend to patients who are brought in. This reality gravely affects the quality of health care given to the patients. Sylvester Basinia admits the seriousness of the challenge but says, though insufficient, efforts are underway to improve the number of mental health practitioners in the region.
Mental health practice is one thing that if people are not motivated enough to step into the field, it will be difficult for you to go handpicking people or encouraging people to actually go into the field. And so, but thankfully, people are turning out. We have Kintampo College of Health, where practicing officers like community health nurses, health technicians, and other cadre of health staff go to advance in that regard. So as we speak, we have some of our staff here who are actually running those programs there. And I'm sure after that, they'll come back for postings. So gradually, the numbers are actually increasing. And so we don't have absolute control over the staffing, but once people are showing interest, I know gradually we'll be able to cover almost all the sub-districts with mental health staff representation. But I must admit that the key challenge that we are actually facing has to do with our medication. There are moments we get some support from the central medical stores, but that is short-lived. Maybe within the year, we actually run short of these drugs, and we cannot actually guarantee a reliable source of these medicines. Basic Needs and NGO into mental health used to also support us in that regard. But on the advent of COVID, we've not had such supports from Basic Needs anymore. And so we are now relying on central medical stores for support in that regard.
We can now hear from CEO of the Mental Health Authority, Dr. Akwesi Osei, who is pushing for the passage of a mental health levy to provide reliable funding for the activities of the authority.
The mental health levy is very crucial because, as you said, there is no way. And when you say that the government is not giving enough money, it's not to say government is not giving anything at all. In fact, the 30 to 40% that you said, other aspects of health care, they are probably getting some 18 to 20%. So we get more because ours is ring fence. But that more is just inadequate. The others are not crying because they generate funds, they generate income, and we don't generate. So government will need to give them money. And there is, even if, in fact, this year, even if the ministry decided to give us all the money that government gave them, it will still not be adequate. So it's not so much the ministry not giving us, but our needs are so many that what the ministry can give is not adequate. And that is why we need the levy. So the levy to us is mandatory. Agreed. Government, we are Ghanaians, we are all crying levy, levy, levy here and there. But I'm sure that this levy is so crucial that no Ghanaian will say, don't establish mental health levy. For us to be able to attend to persons with mental illness. I'm sure as you drive every day in Accra, in the cities, in the villages, you see persons with mental illness roaming about and you are not happy. They could have been taken to the hospitals for treatment if you had the money. So we need the levy to take care of this. The levy, mental health levy, is very crucial.